Sanbonan. Yeah, just wanna share a few stuff. I'm still on generics and understanding generics and medication, understanding what a drug is, understanding how it works, understanding the different dynamics that surround certain aspects in the pharmaceutical world. So I'm still on generics, just to summarize, or rather to conclude on what I was trying to explain to people over the past few weeks, over the past few months to be specific. I did explain that a generic is the same as the product of original research, and I took you guys through the issue of a patent and how it works, and after the product of original research has attained and has passed all the phases, all the steps, through all the testing methods, pre-testing, post-testing, the phases, etc., gets put into the market. It takes a large number of years to actually come to that process. So discuss why there has to be a patent, etc. And after the patent is finished, then other companies, other people, other entrepreneurs, other scientists are able to also make it generics. And the requirement for a generic basically means that it has to be the same as the original research, the product of original research. So meaning that a generic has to have the same molecular structure, shouldn't have a different molecular structure. Otherwise it's not a generic. And then we defined by generic indoni, and I also explained the issue of understanding what qualifies a generic to be a generic. So I said it has to have the same pharmacoequivalence and bioequivalence. So I explained that pharmacoequivalence means anything with pharmaceutical, so the active ingredient, which is what the molecular structure is, that's the active ingredient. And then the dosage form, if it's a tablet form, it has to be a tablet form. If it's a syrup, it has to be a syrup. The route of administration, if it's oral, it has to be oral. If it's injection, it has to be injection. That qualifies a generic. And then also the side effect profile has to be similar or the same as that of the original. So in terms of the efficacy, which means how effective it works, and the affinity, how strongly it binds to the receptors,